Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. I'd like to thank our sponsor for this episode, All In Health and Wellness. If you're looking for a health coach, you're looking for a sports performance coach, you're looking for nutrition guidance, like for instance, a meal-by-meal plan that will help you understand how to eat. It will teach you how to eat, and it will give your body, your cells, the proper nutrition to feel great and be able to perform at your best, not just physically, but also emotionally and mentally. If you're looking for those things, you're looking for the key to improve your sports performance, both from a nutrition standpoint and an exercise physical standpoint and a mental standpoint as you approach your athletic event. All In Health and Wellness is able to help in these areas. Go to allinhealthandwellness.com and you'll find the contact information for how to get in touch with them and get started on the plan that will improve your life. So Dr. Rhee, I want to thank you for being a guest on the Confidence Through Health podcast.
Hey, thank you very much for the invitation. I love this and I'm excited about it.
Yeah, and like when I learned about the stuff that you're doing, and not just the experiences you've had, but also like what you're going into and the regenerative medicine piece, because I think that's where we should be focusing our healthcare dollars, right? And in trying to find ways, because there's so many things out there that are coming against us and that we're doing to ourselves and that we're injuring our body, and to find better ways to heal and to help the body heal is I think where the future really needs to go.
Yeah. It falls in line with preventative, right? So you want to be kind of like, proactive in anything that you do with like, you're trying to get that extra kind of like that percentage of performance, or is it just like you just want to continue on with that exercise routine? It's about recovery. That's all it is about.
Yep.
If you can get ahead of that power curve, then you're going to be so much better in the future endeavors.
Well, and that's the big thing that I've learned as now a 51-year-old athlete that's still trying to compete at national world level. Is like, it's all about how quickly can you recover to be able to do it again, because I'm not 18 or 24 and where it's like, oh, you can literally, we did this in college, right? Where you'd go out and you just like hammer it. For a distance runner, you'd hammer 12 or 18 miles in a day. Then you'd go to a football game, you'd go party all night, you'd wake up the next morning after sleeping for about 3 hours and you'd go run 18 miles. And like no big deal.
Yeah. Those were the great days, right?
Yeah.
Remember like back then when you had no second thought about jumping off of like a cliff or the back of your truck or something like that. Now it's like, wait a minute, what's going to happen if I take this step, So
right. So to be able to have things, because it's when the injury is serious, but not not something that's going to put you in a cast or require surgery to heal from. That's where this regenerative medicine piece comes in, and stem cells, and probably people have heard a lot about stem cells, but they don't know the half of what really is the potential out there, right?
Yeah, stem cell, there's so many. Everybody feels that they have a grasp of the word stem cell or that therapy, but it's so different than what people think it does, right? People think that you take these stem cells from like from either your own body, like the fat tissue or the bone marrow, or you get it from the umbilical cord,
Right.
and that's going to mutate into that tissue. Well, it doesn't. It does more than that, and then you really don't want to have that what they call like a nucleus type of cell in there. You want like a cell free with a signaling. That's what's really important, is the signals that comes from those stem cells that are very vibrant to wake up your existing tissue to turn on.
Mm-hmm. Because the tissue itself has the blueprint, if you will, to fix itself.
Yes,
it's just got to be told, hey, go to work.
Yeah, exactly. So let's go to biology, right? Think about DNA, chromosomes, and these little four codes, A, T, C, G, and they're gonna dictate what this particular cell is gonna turn into. If it's gonna be a tendon, hair, the cartilage. So because of that code, there's no way that this donor site is going to have the same code as the target tissue code. It's impossible. I mean, you're
Yeah.
talking about, so you have to go down to the actual, like, what's going on in biology. So it's the cells are not replicating. The RNA, DNA is not celled by mitosis. So what's going on? Then you have to go down to the next step, which is the telomeres. The
Right.
telomeres are restricting because it's got so many chances to replicate. When it has its limit, called a Hayflick limit, it stops. It goes in senescence or zombie cell. So it just sits there dormant.
Mhm.
So there's a factor that you need to increase those telomeres back to its normal length to have that replication, the cell division. And then on top of that, you need a signal. These signals, like these like capsulated kind of information inside, like you heard the buzzword exosomes, right?
Mhm.
Exosomes is a carrier, and there's information inside these exosomes like microRNAs, cytokines, proteins that signals,
Right.
by cell to cell communication called paracrine effect. So when you get that communication, now you're waking it up. Now you're saying, all right,
Right.
do something, do what you're meant to do. So that's what regenerative medicine is all. So when we were younger, we had abundance of these cells, telomeres were lengthened in a sense,
Right.
and then we had, anything that we can do to regenerate quick. But as we age, those things decline.
Mhm.
And all we're doing is introducing those signalers in a vibrant way to turn on. So that's what the thing is, that find a way to get those signals into your body to regenerate and to
Yeah.
recover faster.
And that's what a lot of the biohacking things are trying to and like better way of putting it is like fake the body out to say like, okay, hey, we're trying to do these things, but there's only so much that's going to be able to do, right? There's only so much that a cold plunge is going to be able to do in a sauna, it's sort of like, okay, you're running out of gas. You can slow down, and it's gonna, you're gonna get better gas mileage, but you're still gonna have to stop and fill up.
Exactly. Yeah. So just think about that senescent cell that's gone into a zombie state. You can do everything you can to actually, like, try to promote healing, but if that telomere is at that length, the cell is not going to divide. There's nothing you can do about it. It's in
Yeah.
its state. You've got to get an enzyme to increase that telomeres back to its normal length, and that
Mhm.
enzyme is telomerase. Telomerase is an abundance in, like, that Wharton's jelly and umbilical cord from the donor's tissue of the stem cell. So they have a high abundance of that. Now, we have telomerase enzyme in our body, but again, as we age, those things decline. So that's
Right.
why, again, we go into that process of, like, declining as we, have an age kind of issue. So if you can introduce that type of enzyme in your body, in
Mhm.
addition to the signals, now you've got a real activated cell. You're looking at that signal. So going back to biohacking and every type of, like, supplement out there, there's merit to some of those.
Yeah.
There's got to be some science behind it, but there's
Right.
everything you can think about. There's merit to this. So as we evolve and we're going into the newer century of, like, medicine and really recovering and then understanding about, you're absolutely correct. Our best experiment right now is with athletes. Athletes
Yeah.
really dictate, because you're compressing them so hard that they have to
Mhm.
figure out how to recover to get to the next type of event. And if you can dominate that world, what that translates back to the civilian world, and then it's an easy transition. Because, well, these athletes recover faster, they perform better, and they
Mhm.
last longer. So now general public, it does it that much better. So
Right.
that's the fun thing about athletes. So when I see, that's why I'm in sports. Sports
Yeah.
is like almost like a lab that
Oh
you
yeah.
can kind of, like, you could experiment. That's why you see a lot of performance centers out there that really work with these athletes. And then once they perfect something in either training or a supplement or some type of protocol, it slides down to the civilian world and it translates that way. So
Yeah.
yeah, so absolutely longevity, that world is about just understanding about regenerative medicine.
Yeah. Well, and with the athletes too, you've got a little bit more of a controlled substance, a controlled environment, because you know that they're working out, you know that they're doing all these things, you know that they're doing their nutrition as best they can, they're doing all the little bitty things, and so there's less worry or concern about, I'm going to see this person today, and then I don't know what they're going to do for the next week and a half before I see them again to get another update or something like that, right? It's like
Yeah,
you're very much into, okay, this guy's telling me he's running every day. I know he's running every day because you can see it in his, you know,
yeah. And the cool thing with an athlete is that once you have every aspect of his training, from diet to, weights to actual running and all kinds of other factors, one little variable change And then
Mhm.
you see the difference right there in the results of like, hey, I saved myself, or I reduced my run by 2 seconds, 3 seconds. Oh, well, something happened here. So that little change, you just amplify that and say, all right, let's amplify that and see. All right, now we got 7, 10 second change. Because oh, there we go. Now we have a path to go towards that performance.
Right.
So that's what's fun about that lab called, athletes.
Yep. Well, and so I live near Baylor University, and I went into their exercise lab a couple years ago for somebody turned me on to the study they were doing for they needed just people that were healthy, not necessarily athletes, but people that were healthy that could complete a 5K. And I was like, oh, I can do that. And they were testing VO2 max along with some other things and correlating some numbers together. And so once they got a hold of me, they're like, you can come back whenever you want. Like, come on. Like, like we love you. Come, like you can do, because anything that they put the parameters, like I can perform.
Yeah, that's
And
awesome.
and so it's great. But the other thing to you mention is like, and I brought this up before we started recording. So I did my VO2 max before I had my Achilles injury last year. And then they had another study and they needed somebody. So I went in. It was probably I'd been running after my Achilles injury and going through rehab and going through the treatment and being off for completely off for 6 weeks, and then 3 weeks where it was like really dicey coming back. So really 9 weeks of like very minimal exercise on the endurance side of things. Um, and then I was probably 5 or 6 weeks into running before I went in and did another VO2 max, and it cut in half
Wow.
in like a 2 year period. But most of that obviously was because of that reduction in time. And so for the athletes especially, but really for anybody, it just shows that when you're laid up from an injury, like how much your body loses from a performance standpoint, an
Oh,
ability
absolutely.
standpoint, right?
Yeah.
And so the things that can be brought into the picture that are less invasive, that are quicker to be able to do, that are able to let you continue to do some of your activity while the other part's healing, I think are massively valuable to not just athletes, but to the general public as well.
Yeah. Like I know as much as all the other athletes know it's about recovery. How fast you can cycle through for your next run. So
Mhm.
it's about the way I explain to these new athletes is what you're trying to do is you're trying to break down tissue, break it down so then you can rebuild it. Now the
Mhm.
rebuilding component is the recovery. So as we're younger, it doesn't take that long to, generate that new tissue,
Right.
make it bigger, better and stronger, right?
Yep.
But as we age, it slows down, so the process gets declined. So if we can speed it up to as we were younger, now your training goes faster. Now your performance gets better, and then your outcome gets better. So
Right.
absolutely, it's the recovery and shorten it back down to where we had it back in our 20s.
Yep. And then and so that's where the stem cell therapy can come in and be a part of the more than just your average, like, okay, I worked out too hard and I'm trying to recover. But when you have those injuries that start popping up, right? And it's like, okay, if I don't take care of this, it's going to lead to this and it's going to lead to that. And then I'm going to be out for 6 weeks.
Yeah.
Um, and so in those instances, that's where the regenerative medicine and stem cell therapy and things like that can come into play to help us like stop that injury from happening, right?
Mhm. Think about so the most prone things that you guys go through are like anything with an avascular tissue, like a tendon or a ligament. So it's
Mhm.
not as vascular as a muscle. A muscle, you tear something in grade one, it heals real fast because there's so many capillaries and blood flow. So much easier access to it.
Yep.
But when you start getting that overuse injury from your tendons, and then it's not that many vessels going in that area. That's why the process is slower. So compound that with age and the decline of those cells to regenerate. Now you're having a slower process of regenerating. So
Mhm.
if you can just take a component and speed it up, well, that gives you a better edge on your recovery. So that's what you're
Right.
trying to do. You're trying to get an edge of just getting that vascularity in those tissues instead of aging with it.
Right. And that's and it's helpful though for everything, right? Like for your whole body, right? It's not just
Oh
like,
yeah.
okay, we're going to fix this tissue, but it's also helping the rest of the body as well, right?
Yeah, absolutely. Think about I mean, you're okay, so I'm musculoskeletal, so I'm looking at just the connective tissue of the joints and ligaments and stuff
Mhm.
like that, right? So, but think about the other joints that associate to your visceral, like your heart, your cardiac tissue, your pancreas, your liver, and stuff like that. Well, I mean, they have cells. They do the same thing as these other tissues. So it
Right.
goes hand in hand. So
Mhm.
what we feel as athletes, our visceral side, well, it does go to the same compromise. So
Mhm.
you have to just understand that it systemically it has to work everything, and that's what
Mhm.
stem cell does.
Right.
Stem cell, when you target stem cell for the injections, well, majority of it will go. They call it the honing, right? It hones
Mhm.
to that area. But there's consequences of it. It spreads out systemically to the other tissues too. So people report like, I feel better, not just locally in my knee with the injection, but overall, I'm starting to feel better. I start feel like more of a like a awake.
Right. Right. And I do want to also say, because it's I've had family members that have had knee problems or things, and they're like, okay, I'm on track to get a knee replacement, and so and I'll throw out, I'm like, hey, have you even talked to a doctor about stem cell and see if that's even an option to help you avoid a total replacement, because of the timeline mainly that goes along with the replacement. And you would probably agree with this too, is that like if you can avoid being cut on for surgery, like that's always the better option, right?
Oh
Because it
yeah.
opens up the door for so many other things to happen.
I
Um,
mean,
but the response I often get is, well, they won't do it, or I have to go to Mexico, or I have to go to Panama, or I have to go to, right, I have to go somewhere because it's not as easy to access in the US.
yeah. I mean, there's some truth to that because number one, the FDA. So probably like 3 or 4 years ago, it was not really regulated in the regenerative world. There are some companies that put the FDA in a like a alert state, like, hey, what's
Mhm.
going on here? So there's some restrictions coming on, and you see it coming on a little more so.
Yeah.
So I understand why these companies are going to like Panama or Mexico to open up their clinics. They're over because there are less restrictions there.
Right.
But in addition to the restrictions, less restrictions, it also you look at like the tough thing with that is that, we obtain our tissue from an ethical source, from the
Mhm.
umbilical cord during C-section delivery. So
Right.
it's monitored. There's a traceability to it, and then we have the path to find out exactly the donor tissue, the mother, and then continue on from that point with the FDA cleared lab. When
Right.
you go to a third world country, you're in a third world country, so you are
Mhm.
getting involved with tissues that you might not. You think you're getting stem cells, but there are stories of it's some of it are known to be like vaginal tissue.
Mhm.
Some are even going into the world of so we get ours there's many kinds of stem cells out there. So ours is what
Right.
they call mesenchymal stem cells. Some labs out there in third world countries, they use embryonic stem cells. So that's from aborted babies. So now
Right.
the problem with that is that now you're taking tissue that's maybe like, constructed to do like generate into a hair follicle or something else. And then now you're injecting into your body. So
Right.
you're kind of shooting, yourself in the foot if you're like going for it. So
Yeah.
I understand what they're trying to do, but you just have to concern yourself with some type of regulatory system that maybe has some safety factors because
Right.
that's why I understand why people say Mexico is the easier route, but again, Mexico or other third world countries, well, they don't have that restriction either. So
Right. Yeah. Well, and that is a big piece of getting the right type, the right stuff, right? It's like if you were, getting an ACL repaired and you put the wrong type of tissue in there to replace the tendon, like, or the ligament, then that's, like, it's going to tear again. It's not going to hold. It's not going to do its job.
yeah,
You've got to replace it with the right stuff.
yeah, but not saying nothing bad about them. It's just that I understand why people go to
Yeah,
or companies go
of
overseas and
course,
stuff like that. So
of course.
you know, but the thing that I do know is the so when I talk to other physicians about stem cells and just hear what they say,
Mhm.
they're limited in their knowledge. They're still in this world of stem cell. They call it differentiate. They differentiate into the target tissue cell, and I ask them the further question. Well, how's that? So they said it just knows. I said, well, you got to be more specific. You just can't just say that. You have to explain to me how that particular chromosome from another tissue is going to turn into the same chromosome as the target tissue, and they can explain it. They go into like differentiate. It just knows. I'm like, then you lost me there.
Yeah.
But now there, no, where I'm at, it's signals. it has to do with signaling. So you already have the chromosome, you already have the DNA expressed in your target tissue. It's there. All you gotta do is turn it on. That's what it's
Right.
all about.
Right.
There's no way possible you can match a donor from over here and all day long. It's like almost like
Yeah.
having like a kidney transplant. Goes, oh, don't worry about the kidney, the biometrics. Just send it over here. It's
Yeah.
impossible. So that's
Right.
why it's not so much about the live cells. It's the signals that's come from that.
Right. That makes a lot of sense, and it's that by itself is why you want really somebody that knows what they're doing and understands it, because otherwise you really could be like, and people ask me this all the time, like, what vitamins should I take? And I'm like, I mean, I could tell you what most people need, right? Or I could tell you what everybody needs, but I don't know what you're deficient in and what you should spend your money on. And because I could tell you to take something and you're just going to flush it right out of your body because you don't need it.
100%, 100%. When no, so I have a wellness practice in my office too. So
Mhm.
what we do is we go into that world, and the big thing you need is biometrics. You need to know
Mhm.
existing, like what's going on in your body, right? So
Yeah.
the first thing we do, we draw their DNA. Their DNA is a blueprint. Then we
Mhm.
see your DNA and we go after like a micro of your B12 or something like that. So then it's all right, let's look at my B12. And then we see there's something going on as far as your gene expression of that particular,
Right.
micro. So then we say, all right, so what's going on? Then the next thing we do is draw blood. We draw blood and then we look at your B12. Are we in the upper range or lower range? Or are we exceeding the ranges? So
Mhm.
then it tells you that, hey, you got a genetic code that says something's wrong with your B12 maturations or something. And then you look at the blood work. Yeah, it is confirmed that you do have an issue. Now let's address B12. So what's going on? Typically, they say, I'm a vegan, I'm a vegetarian. Well, you need B12. You've got to take a supplement. Then you go into the
Right.
world. Then you start thinking about like, how are you taking? Well, I do take B12, but I take this oral. But, well, you might want to think about doing sublingual because the acid in your stomach is denaturing too fast. So
Right.
take a supplement. So, there's a process to that stuff. So you're absolutely right.
Yeah.
You have to find out who they are specifically to go into that world of advising. So with
Yep.
that, you go into the stem cell where you've got to find someone that knows their stuff.
Yep.
But anyways, but I apologize. But
No good.
going back to those other countries, and they're doing their therapy, and then but the interesting is that they concentrate on cells, right?
Hmm.
Well, if you understand about what they call the cell-free bioactive biomolecules, or the cell-free world,
Hmm.
it's the signals, right? It's so now you don't look at the actual live cells, you're looking at the signals that they call it EVs, the extracellular vesicles. When you look at that, now you're saying, okay, I can get these here in the States. I can get them
Right.
through exosomes. And now the big thing is that delivery mechanism. How am I
Hmm.
going to deliver to? So is it still the injectable world that's been going on forever, or the
Right.
new trend that's coming out, which is topical? And
Hmm.
that's where, I see the future, because now when it's topical, now it's really in the hands of patients, and then they
Right.
can grab it and they can just, as long as they understand how to apply it, it's now, very simple form.
Hmm. Well, and that's like tracing that back, right? Is super beneficial, and I think that's the thing that a lot of people and athletes are a lot of times, like, especially when there's an injury, a lot of times we're just like, I don't care what it is, just fix it. Just like, I don't care what we got to do, just get me back out there tomorrow, right? Whatever it is, it's got to be done. Um, and sometimes we'll go to wherever somebody is going to be able to say, oh yeah, I've got you fixed here, boom, like I'll get you back out there, when it's not necessarily the right fix,
Yeah.
and I deal with this with the people that I coach all the time. I actually had a lady this morning. She's been having some heel pain when she's walking, and so I've got my camera out. I'm videoing her walking, doing everything, and I'm like, you're not using your big toe at all. Like, you're totally not. You like the other foot, you are, that one you're not. You're totally like avoiding it. And is it so now? It's like, okay, well, is it a strength issue? Is there an injury in the big toe we don't know about? Is there like, but it's without having that kind of trail, just going like, just fix it. Because you could be like, okay, well, just go buy new shoes. Well, that's not going to fix the problem, right? It's
Yeah.
going to mask it for a little bit till the softness in the shoe goes out, the support goes out, and then it's going to be back. And she'll be like, oh, now my heel hurts again.
Yeah, 100%. Just going on that, you can, now let's say she had like a turf toe or
Mhm.
some type of bunion situation, so she can do that. But her biomechanics hasn't been corrected, right? So
Right.
you can do regenerative medicine, you can do everything you can to, to mask the pain or cover it up right there,
Mhm.
but you still have the poor biomechanics. You have to
Right.
correct that. So, like you said, trail back to the onset or the real cause of this whole thing,
Right.
correct that, and then move forward. So
Right.
that's how I look at my athletes. So they'll
Yep.
come in here with acute situation, like they sprain their ankle or they've got some kind of like something in their knee, right? So then
Mhm.
we do a real quick assessment and we figure out, okay, so we have maybe like a lateral collateral ligament issue, right? So you can address that, but in addition, you have to go to. So I always tell them, okay, we'll do the acute stuff, but there's something underlying that we have to go. Then we'll
Mhm.
go after things like the tensor fascia lata that connects to the
Right.
IT band. So then we go into the whole schematic of what the body's involved with, and then we
Mhm.
just go through the kinetic chain. They say chase that thing, so you're gonna
Yep.
chase, and then you're gonna figure out, wow, you can go back years in history and find out it's always been about the ankle sprain that he had.
Right.
They adjusted and then changed the biomechanics of the hip and the knee got
Yep.
compromised. So yeah,
Yeah.
absolutely. So you have to go back.
Yep. And the same thing with the like the stem cell therapies and the different therapies and the regenerative stuff because it's if if you've got a topical and you're putting it on something that because that's where the pain is and that's where we identified that, but it could be a secondary injury from the original injury that maybe didn't hurt as much and we forgot about because I mean, how many of us? I mean, my dad would always say like, "Oh, it's because of my old football injury," right? Like, how many people have that? Oh, it's because of that old injury back from high school or college that they never dealt with, or that they dealt with, but the medicine has progressed so much more now. Go back and get it reevaluated and retreated, right?
Yeah, how about when you let's say that ankle injury or that the heel injury, right? So what I see in my office is that they'll come in for like a heel thing, and this maybe
Mhm.
just kind of like maybe I don't know, like a little heel spur or something, like some type of like heel, the fat pad in the heel is kind of irritated, so we'll treat that. Then that goes down and it goes, oh, I feel better, but now my knee hurts. So I always look at the hierarchy of pain, right? The
Yeah.
one that's the highest in his pain in his threshold is the one's going to show up there, but he still has that underlying thing, right? So
Mhm.
the knee pain's
Mhm.
there, but the heel pain's more acute. So
Yeah.
as that pain declines, all of a sudden this shows up with, oh, now my knee hurts. Well, then they have to think about, oh yeah, I had this prior to my heel pain. Then you have to see how, like you said, go
Yep.
backwards, and it just leads you, chasing that thing. Then it's
Yeah.
going to chase you around the body.
Yep. Um, and then, but the regenerative side of it is that if you do all those things and do it correctly and activate the telomere to get the things get everything like almost like you're going backwards in time with it, like
Yeah, you're gonna.
from a
It,
aging standpoint to
yep,
then everything's going to improve going forward.
absolutely. So, but on you're chasing it just like you were talking about. So you're going after the heel, you're going to go after the knee, you're going to go after, and then you're going to see that that's going to lead to the original pain. So you've got to clear those segments out. So it's the
Mhm.
heel, knee, just keep on going, and then continually working on that biomechanics, the
Mhm.
acuteness, the pain, and then resolve that and correct. So then when you continue on moving forward, now you're in the right proper motion, and then you can
Right.
not be in that scenario of that pain.
Right. And so what because I know you've got a military background. What brought you into wanting to dig into helping people with this on the health side of things?
You know, okay, so I think where it really started from was my dad is a physician, right? So he
Okay.
was a surgeon and then he went family, so he just went in the easy route.
Mhm.
But I always seen him help people, and it was probably like, I don't know, maybe it was taught as a young child that he helps people. He helps people in every aspect of, if it's financially they can't afford it, I see him, like, okay, don't worry
Mhm.
about it, we'll take care. But it was that rewarding feeling of people, getting better, and they
Right.
reciprocated back was thank you very much. And I saw that. So as I grow up, I'm playing sports, and I'm kind of like, it's almost implanted in me that I'm gonna be a doctor. And then all of a
Yeah.
sudden, I try to link up sports and stuff. Well, the military got involved because I was like a typical bad kid, and then I got in some trouble. So
Yeah.
my route was the military.
Yeah.
But what the military put me in a good frame of mind for of these, like, I was a pretty wild kid, and it seemed like I was in a mode of not completing things. I was like almost like,
Mhm.
like, oh, I was every scenario kid that you can think of in
Yeah.
that teenager young man stuff, right? So what the military gave me was, I had the background and I had the thought of a doctor.
Mhm.
And then what the military gave me were like discipline, really
Mhm.
acute discipline,
Yeah.
but achievable discipline. Not so much like you have to run this every single day. It was more so that we're going to work up to that, and then we're going to make these micro wins, and then from there we're going to become this person. And
Right.
it taught me that. So with that, it taught you the confidence, the ability to like achieve and move from
Right.
that point on. And that's where I got. Some people don't need the military, where
Mhm.
I did. I needed military. So now I have the combination of discipline, going for your goals, achieving things, and then the longing to help people. And
Mhm.
it married well together. And then
Yeah.
from there, it was once I got out of the world, I started thinking about, okay, I always like sports. I didn't want to go in the invasive world that my dad and my family members went into the
Mhm.
medical side of it. So I wanted the non-invasive. So I looked for the best sports chiropractor out there. I found him, and that's what I want to do.
Yeah.
And the reason why I want to go sports is because I'm familiar as an athlete. I know what we go through.
Yeah.
It's hard to go see a doctor that doesn't really participate in any kind of sport or
Mhm.
hasn't been in that caliber of collegiate sports because they don't have that mindset that athletes do.
Right.
Some athletes they want to push hard. Like you said, I don't care, just fix me. And
Mhm.
then it's very mentally fatiguing when you're injured. When you're
Yeah.
injured, you are shot, and it really plays toll with your emotions and everything else. So if you have a good support group, it pulls you through that end goal,
Mhm.
which is healing, get back on the field, get back on the track.
Right.
So that's important. So now I'm looking back, I look at myself like a mechanic of a race car.
Mhm.
I'm in the race car setting. So my job is to
Yeah.
get that car best performance so he can perform on the track. And then whatever happens out there, it's my fault. So it's my job to make sure that athlete's at his peak performance.
Right. I love that analogy, and it's so true. The other piece that you said, so this was 2016. I ruptured my PCL in a water skiing, and I didn't have surgery on it, so it still floats around. But because the doctor I went to see, I got one opinion. I went back to my old college doctor at Texas A&M and was like, I need a second opinion from a sports minded guy, and my wife needed it too. And I'll never forget that conversation because I'm on the table and he's looking and evaluating it, and he looks at me and he looks at her and he looks at me and he goes, "Why are you here?" And I was looked at her and I was like, "She wants to know that it's okay for me to run." And he goes, "Go run." I was like, "Okay."
Yeah.
um, but but when I went to therapy the first day to be evaluated for physical therapy, the guy that evaluated me, I showed up. I'm in my running shorts. I've got my brace on my knee that the doctor had given me, but I'm in my running shorts. I'm like this is an evaluation, yes, but let's do something, right? Like let's go. And he looked at me and he was just sort of like, okay, what are you like? Almost like, what are you doing? Like, and he get on the table, evaluate, and he's asking me all these things, and and he said, well, what's your goal? I said, my goal is to run a half marathon in 6 months. And he was like, he sat back and he goes, I'm not the therapist for you.
Yeah.
And I was like,
Yeah.
oh. And he goes, I've never done sports. He goes, I like this for the medicine side. I like helping people, like healing people. He goes, I can't work with you. And I was like,
Yeah.
oh, well, thank you for your honesty. Like that. And thankfully in their practice, there was a girl who had run cross country in college. And so she was like, I still put her to the limit, but she was there. She understood. She was like, okay, we're gonna push the boundaries a little bit. The doctor says this, we're gonna push as close to it as we can, as quickly as we can. And so that's the athlete mindset. But I also think, and one of the things that she did that that I totally grabbed onto as soon as she told me, she was like, okay, we're gonna do this exercise. And this was probably 2 months into therapy. I want you to come sit on this table next to this other lady who had knee problems as well. And she was like, I just want you to do them next to her, just talk to her. And that the other lady was like in her first week or and so I'm doing them and I'm talking to her, and she was just like, wow, so it does hurt. I'm like, oh yeah, it hurts, but you still got to do the stuff at home. Like if you don't, it's just this is going to take forever. It's not going to get better. It's not going to. And the therapist was like, "Thank you so much." That's what she needed to hear, was that she has to own some of this on her own and do it on her own. She can't just do the hour that she comes here twice a week or 3 times a week and expect it to be back to where it was when she's done with what the insurance is going to pay for.
100%. Let me to add on
Yeah,
that.
go ahead.
So my office, I have a rehab place, and then so ours is a little interesting because we're in the second, third opinion of like
Hmm.
failed like ops, operations, stuff like that, and then rehab and all that stuff. So they come in here and or they come out of a surgical world. So
Hmm.
one of the things that uh I know about people is that the mindset's so important, right?
Hmm.
So when I see these guys come in here, they're really like, like searching. They're searching for the confidence that I have, our office has to help you out.
Hmm.
So I tell like our mission statement is we treat everybody like a professional athlete. So you're going to get pushed. You're going to get pushed to maximum to where I know it's safe.
Hmm.
So when it comes to like let's say we had a rotator cuff injury, right? So my job is to reduce inflammation and then make sure you get the range of motion without turning on that muscle. You can do
Hmm.
things.
Hmm.
So there's some therapy places where they're very passive, they gently go through there. Well, the fear is that when you're an athlete, you don't want to have excess scar formation. You don't want
Right.
restricted in that joint. So you've got to get that joint moving as free as possible. So then when it lays down correctly, it's laying down in its orientation, not like
Hmm.
woven fiber, like a bone structure, right?
Right.
So exactly. Like, you have to find the right therapist. If you don't feel comfortable with that person, he's not pushing you because, they have these standards like 2 to 4 weeks, you should be here for. Well,
Hmm.
some people heal faster and some people are able to handle that type of, that kind of like that therapy
Hmm.
quicker. So then you need to learn how to speed them up and slow them down when it's needed to. So it's a good guy, but the therapist you want are the ones that understand you and how your body moves and where you're
Hmm.
at in your fitness level, and then you go on from that point on. So
Right.
I'm glad you found that person
Yeah.
because in our office, they always say, after they come see us from another office, because, well, you're different. I'm like, well, because you're different. Every person in this office is
Right.
different. I can treat you like an athlete. I just can't treat this person that has never been into a squat position in 10 years
Right.
into that kind of heavy load. So we have to work them through it, but we all have to kind of continue working, do your homework at home and all that stuff. So
Right.
yeah. So it's really important to find that right person, that right
Yep.
therapist.
Yep. And that's it's also hugely important from the longevity side of life, right? Because having the right therapist is going to make sure that you're ready for whatever you're going to tackle, right? And it's not just, okay, well, you 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 met the guidelines for this injury's recovery, and so you're done, right?
Yeah.
But that could be perfect for as far as like, okay, well, this the range of motion is back, but that doesn't mean I can go do whatever I was doing before.
Yeah, you gotta keep going. So just in your level, you're the extreme level, right? So then
Hmm.
I take you and I treat like everybody like you. No matter who you are, you're gonna be like this person, Jerry, right?
Yep.
So I look at you and I say, all right, you are doing weekend events, you're doing one thing at a time, these guys. I'm like, all right, now are you going to be as intense as you are, Jerry? No, of course not. But
Right.
you need the support group. You need to know how to
Right.
recover. You need a medical team. You just need, and also need downtime. You
Mhm.
gotta really understand about the mental and the physical downtime. So it takes a team. So I tell everybody, just don't go through life just like like aimlessly, jumping doctor. Once you feel your right group, stay with
Yeah.
them, and you guys will learn. And then that doctor adapts to your body, your anatomy, so we can understand that, all right, when you come in for injury, it goes, okay, I knew that was going to come down because your biomechanics is off. You didn't
Right.
work on it. So let's try to work on that more.
Right. Yeah. No, exactly right. And I've got a new physical therapist now from the one from that injury because of different things that have happened. And she was a college athlete, and there's two other people in there in her group that were college athletes. And so for me going in there and any athlete I send in there, I know they know what it's like. They've been through it. They know what the goals and desires, because it you have to have talent to get to college, but if you don't have the desire, you can't compete in like it's not going to work. Like you're going to get chewed up.
Oh yeah,
right? The
that's a
system is
fun.
just it's too aggressive.
Yeah. So my first job, believe it or not, was at UCLA. So it was track and field and other sports. But
Mhm.
you see them. You see exactly what you said. Everybody, when you get to that level, talent is all over the place.
Mhm.
It's the hard work. It's the extra oomph. That's that. And then
Yeah,
how to like, everybody will get into some type of injury mode. Something's going to happen to
right.
you. It's how you recover in the mental and how you get into the training room and really go through therapy and be diligent. Some people go in there and just kind of play around and like go half ass into this thing,
Yep.
right? Say, yeah, I'll just work on it. But others like really push themselves to get themselves back on that track. So it's an interesting world, like you said, talent versus that desire to go on to the next level and go
Yep.
push themselves.
Yep. And for the general population that is dealing with injuries as we age, it it's not really a talent thing so much as it's having the desire to ignore the, oh, I'm just aging, so it's just part of life, right? Oh, I hit 40, it's just my body's going to fall apart, or whatever you think that magical number is, that all of a sudden, but it doesn't have to be that way. If your desire is to go ahead and keep your body in good working function form, all of those things, like you said, you've got to have a team, because yeah, things are going to happen. There's
Yeah,
statistically things are going to happen. You're going to roll your ankle stepping off a curb. You're going to do things that are just, why'd that happen? No idea.
yeah, and
Having that team is what you need.
yeah, and like you said, like when it comes to like what you're doing as far as coaching people, there's always there's an end, right? There's an end.
Mhm.
There's a race or something there.
Right.
That's where the vision's at, right? So the athlete
Yeah.
sees that, and these intermediate steps are where I come in, Bob, because all right,
Mhm.
keep you aligned, keep you straight, make sure that elbow issue that you're having from that kind of like throw motion is
Right.
solved, because we're staying on top of it, but you're always looking for that end goal, which is
Yeah.
that event. So that's why it's a fun game, even down to the level of civilians. There are like these 5K races they can look at,
Yep.
or anything. I want to lose 20 pounds. All right, then whatever you want to set yourself, but have yourself some type of future goal. You need
Mhm.
something to achieve, so then it's easier to kind of take those steps and have like a determination or really a reason and why am I doing this? So
Right. Right. Well, and that's one of the things I tell a lot of people that come to me, and they're just like, okay, well, maybe they don't have any athletic goals or any of that kind of stuff, but they're like, okay, I want to lose some weight. I want to, and like, okay, well, why? Well, because the doctor said so. Okay, but why do you want to do it? Not just because, okay,
yeah,
you want to be off medication. Okay, that's a pretty good goal, but like, once you get off medication, what's going to keep you motivated to continue to do these things, right? And so one of the things I always drill back down to, and it's because of the relationship and it impacted my life so much, is like, okay, do you want to have grandkids? Do you want to be around for your grandkids? Do you want to take your grandkids fishing, or watch them go at their dance recital, or walk them down the aisle at their wedding, or do whatever it is that, like, you get to do as a special treat? And that automatically everybody's, oh yeah, okay, well, now you have a really big desire to make sure that your body is taken care of, so that you can be old enough to experience all those things with your grandkids.
absolutely. That falls in line. So wellness in the sense of just like like just wellness, and there's corporate wellness,
Mhm.
and how to incentivize people, how to get
Right.
them changing their behavior. That's what this is
Yeah.
all about, right?
So yep.
So if you look at like data about corporate wellness, it's a big failure.
Mhm.
It doesn't succeed because you can incentivize them with like a gift or something. These people, I mean, they think no big deal. I want to eat what I want to eat. I want to relax.
Yep.
Food makes me feel good.
Right.
So in my wellness program, we don't do that type of incentivizing, like to say, hey, you want to lose weight. What we try to do is we try to link in their family history. Then we have their genetic aspect of it. Then we have a little test called the ANS test. It's the autonomic nervous system, and it has risk factors based on how
Mhm.
your body responds to these orthostatic movements. So then you can show up like cardiovascular diseases, diabetes, and it's predetermined prior to showing up in your serology or blood work.
Mhm.
So that's what's cool about this. Now they say all of a sudden it gives them alert like, well, my dad has diabetes. My A1C looks good, but all of a sudden this test shows up. Hey, you're going down that pathway of being insulin resistant, and all of a sudden it freaks them out. So just like you said, because I don't want to be that person. So you have to link in that future person to the present and then say, let's go down that path to avoid that bad
Yeah.
scenario. So
Yep.
yeah, absolutely, it's a good motivator.
Yep. And that's really, I think, what all the regenerative medicine, the longevity, all the different things that are gaining speed now, and where we should be spending our healthcare dollars. We shouldn't be helping people that are sick. I'm not saying that, but like, that's where our focus needs to be, is like, how do we get these things so that people can see them and know that they're real, and know that the potential is there to truly change your life. And then aging doesn't have to be this thing that we look at and hope that we don't, turn out like these old people that we see.
Yeah. So I look at those two age spans, right? There's the lifespan and active lifespan. So I
Mhm.
look at the word active lifespan. I want to elongate that. So when you turn 80 and you want to be active, you want to have that travel where you can take the Euro travel and you hop on
Yep.
trains and no big deal and pull the heavy luggage as you're going around versus like looking at a TV screen goes, all right, well, I'll do the virtual tour and then, not
Right.
really be there for the actual, like all the century, right?
Yep.
So when I I'm so fortunate that I get to see that live in my office. So I see, from athletes all the way to the 80s, and I see
Mhm.
that, and I see their progression as, someone that's not active, and I see their outcome years later. I'm like, oh boy. So
Mhm.
I know that I don't want to be that person. So I have the
Yeah.
luxury of seeing it. Now, if I can translate that to this world and figure out, how do I relate this to normal people, and that's through, stem cell therapy, just knowledge and educate them. Exercise is so important. Exercise, because once you hit a certain age, there's no more building muscles, no more
Right.
improving. You're sustaining. Now you're going to go in this world called sarcopenia, when you're going to
Mhm.
start wasting away. Just maintain good biomechanics, know your behavior, and stay with
Yeah.
it. And it continues on. It will
Yeah.
go as long as you understand about recovery, pushing, knowing your limitation, and is continually going. It
Yeah.
just and then in your 90s, you'll be that person everybody's telling you, "Hey, you look like you're 70." That's the goal right there.
Right. Yeah. That is totally the goal. And not just to look that way, but be able to act like
Act like that,
you're
yeah.
younger, right? That the body will actually do the things that you're trying to get it to do. So, yeah. So, Dr. Rhee, so tell us how
Heck yeah.
people
How
can
about running
get
a
involved. Like,
3,000 at 9 years old, huh?
oh my gosh. Well, and I've told people, like, because they're like, okay, I've won a national title and that kind of thing, and they're like, oh, people that don't necessarily know that, like, okay, I'm good, but then some of these, like, top athletes that just run, like, as soon as they hit 50 or 55 or 60, they'll just come out and they'll just run another race just to set the world record for the age group, because they're, you know, Bernard Lagat's one of those guys that I'm like, can you just stop? Because he'll just come out because we're the same age, and so every time he hits 50, he's like, bam, he runs and he's like a minute and a half faster than me, and I'm like, okay, I don't have a prayer. Until I just outlive everybody, and I'm like, I'm
Hey,
just gonna outlive everybody and then be able to be setting world records.
but it's still great to be competitive, I mean,
Yep.
that's the most I think that is your longevity secret, that the
Mhm.
competition to perform and
Yeah.
then finding the edge and then continue on. That's
Yep.
huge.
Yep.
Hey, remember
So
remember that guy Jack? What's that guy Jack? Remember that guy Jack LaLanne? What's the guy?
Jack
The guy?
LaLanne, Jack
Yeah,
LaLanne.
remember
Yep.
him?
Yep.
That guy was a beast. Remember him in his
Yeah.
90s? Oh,
Yep.
still going at it.
Yep. Yep. Yeah. That's the goal. That's the goal, is to still be the guy that's out running around and people are going, look at that old man.
That's awesome. That's awesome. We're gonna say that about you because look at that old man
Yep.
go.
Yep. Yep. I
That's
hope so.
awesome.
So how could people connect with you, follow you, like, for more information on what you're doing?
Yeah, there's a website, regen.com. And then there's social media. If you just look up Dr. Tommy Rhee, there's my office, Physical Chiropractic at Tampa Bay. And then I have a book out there. It's on Amazon. It's the Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy.
Cool.
So, I think you just Google my name, you can see things out there.
Yeah.
So I really
Yeah.
enjoy this, man. This is great, Jerry.
Yeah. This is awesome. Thank you so much.
All right, man.
Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.